It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, folks. I'm Sam Lesante. You know, I keep talking about healthcare and how it's improving in northeastern Pennsylvania, particularly in the greater Hazleton area, from Wilkes-Barre down to Tamaka, hometown. The Lehigh Valley Health Network keeps on improving. But what do we know about the CRNPs? CRNPs, what do they do? Are they needed? Are they valuable? Well, today we're going to learn all about CRNP, and that stands for Certified Registered Nurse Practitioner. And on the show today we have Jennifer Yourey and Laura Herbener, both CRNPs, and they're going to tell us all about it and why they're needed. So girls, thanks for coming on the show.
Thanks for having us.
I'm going to learn something today. I learned something on these shows. You know that, Laura? I learn all the time. Now, Jennifer, you're in hometown, right? Yes. How are things in hometown?
Good, wonderful.
Great people down there. I like.
They're very wonderful, yes.
Yeah, and you're up there in Mountaintop, beautiful location. You know. I tell you, the facilities are just great. With all the state-of-the-art technology, just wonderful. Now, CRNP. Okay, let's start with you, Laura, and then you can chip anytime you want, Jennifer. Certified Registered Nurse Practitioner. Okay. Now, what education, requirements, and why are you needed?
The education requirements are a master's or a doctorate degree in nursing. So, for an example, myself, I have been a nurse for 18 years, and I went on throughout that time and furthered my education until I achieved my nurse practitioner, which is a master's degree, and I've been practicing for about the last year. All told, I have about 8 years of education under my belt. Why we're needed is for access. Access can be difficult, especially in family practice or internal medicine. Patients have a hard time getting appointments. Physicians are overloaded. And so we can help with that.
All right, now, your experience, Jennifer?
My experience is similar to Laura's.
How many years have you been?
I've been a registered nurse as well for approximately 10 years. I have 8 years training as well. I have a master's degree in nursing just like Laura. So our training is very similar. As practicing as an RN, I went back to school and obtained my master's degree in nursing and became an adult health nurse practitioner.
Okay, so now, why didn't you decide to be a doctor then? I mean, you ever think of just going and become a doctor?
No. So for me, we get that question a lot. But for me, I became a nurse because I wanted to be a nurse. It's a different approach. I am a nurse until I die. And so I wanted to be able to provide more care to my patients and kind of drive the care for my patients, but still with my nursing focus. And that's what a nurse practitioner can do. So medical model and nursing model are slightly different in the way that we approach things.
So the doctor does what, Jennifer, versus what you do?
We have similarities. We also have differences. We are able to prescribe both prescribe medications. Doctors, of course, have much more training than we do, but we also have a lot of clinical training on top of the training we had from our basic nursing school. That's why we're also referred to advanced practice nursing. We are not your typical nurses that some people think that we are.
Now, you have physician assistants.
Yes.
Okay, so what's the distinction here? Because I'm getting confused. Okay, we have the Certified Registered Nurse Practitioner.
Yes.
Then we have the physician's assistants.
Yes.
Then we have the doctors.
Yes.
Okay, so where does this play from physician assistants to the CRNPs?
Physician assistants go to school for approximately 5 to 6 years, usually come out of high school and go to school for 5 to 6 years, graduate and take their boards and become a physician assistant. Typically, a nurse practitioner goes to school, works a few years, has the clinical experience, the clinical training, goes back to school for the bachelor's and the master's, and then, or sometimes has the clinical training, the RN, so they have all that background and training, and then goes to school for their master's and takes their boards. So they have a lot of clinical experience and then takes their state board, or excuse me, their national boards to become a nurse practitioner. So we could practice independently as nurse practitioners. We have a collaborating physician. A physician assistant has a supervising physician that all of their charting has to be co-signed by a physician. We do not. We actually could have our own practice.
Is that right?
A physician assistant cannot.
And why is that, Laura?
Because the physician's assistants were designed to be exactly that, physician's assistants. So we work in collaboration with our physician colleagues, and physician's assistants work under supervision of the physician's assistant, or I'm sorry, of the physician. So it's two different distinctions.
Okay. So my mindset would be, when I'm going to, medical facility, the first thing is I want to see a doctor, okay? Because people, we want to see the doctor. We don't want to see a practitioner nurse. We don't want to say, I want to see the doctor, okay? And you don't blame people for saying that. So how do you put me at ease knowing that when I come to your facility, how do you make me feel at ease knowing that I'm going to get the same kind of care, okay, hopefully, than if I saw the doctor? Because as you said, today, with the community, our doctors are jammed, they're overloaded, okay? So how do I feel comfortable with that? I'll start with you, Jennifer.
In my opinion, with our nursing background and our clinical background and our training, we spend more time with you. We have the approach that we have the tendency to explain things to you so you have a better understanding of it, whether it's your disease process, your medication, or if it's an acute condition such as a sickness, a cold, a cough, pneumonia, we're going to tell you what's exactly going on with you, the medication that we're going to prescribe for you, and how it's going to affect you, side effects, or if it's going to have potentially any interactions, or if not at all interactions with any other potential medications that you're on.
So I could trust you and what you're doing.
Absolutely.
Okay. So then when do you decide, Laura, that, this is a little bit more than what I can handle, okay? When does that point saying, well, now I have to go and get the Dr. Lesante or whatever the case may be? When does that come into play?
If I am with a patient and I have decided that I need to reach out and talk to a physician, we are very close within the network. So
yes,
we have a bunch of choices.
Yes.
And then we also have our collaborating physicians. So, and we don't hesitate to do that. This is not about...
Well, doctors do it themselves.
They do. They call each other, they call the specialists.
Yeah.
So it's very similar, and we're not afraid to do that. We will do that if we feel that we need to.
So I could, here again, I'm thinking for the person out there, to make them feel at ease that when they're going to a facility and there is a CRNP, as a certified registered nurse practitioner, that I'm going to get the proper care, okay? The community, as you know, has grown. So what have you seen as far as when you first started, okay, because I didn't know what CRNPs were. And first of all, anyone's in the health profession, whether they're practical nurses or whatever, they are to be applauded because it's an interesting profession. You have to be dedicated. It's certainly not for the money. You have to be dedicated, and I applaud anyone who's in the medical profession. We're very fortunate to have Lehigh Valley here doing what they're doing in terms of networking, and that's so important. So what have you found in your own personal experiences in the medical community with you being who you are, a CRNP? I'll start with you, Laura.
The first that I would say is I've had more than one patient say to me at the end of our visit, I didn't really want to see you.
Yes. Yeah.
But I wanted to see somebody sooner than what they could get me in with the physician. And I say, okay, I understand that. And every time they've said, I'm glad I came. So I would say first is give us a chance. We are fairly new to this community. We've been around a long time. One of our nurse practitioners is in practice for many years.
Okay, so this is nothing new.
This is not new.
All right.
But to our community, it is a little bit new. So I see that we are improving access already. I have several new patients who were told that they wouldn't be able to see a physician for 2 months. Wow. Just because they're that loaded. We have a lot of healthcare needs in this community. So I see access improving greatly already.
And do you find the same thing?
Yes, I agree with Laura. I've had patients that the doctor got, pulled out of the office or for an emergency, and his or her patients were offered to me, and the patient actually refused, but then agreed and said, I'll only see her this one time because the doctor was out on an emergency or whatever the reason was. A few patients then had refused not to see the physician ever again.
I'll see Laura. But, yeah. Forget about the doctor. I want to see Laura and Jennifer. Yeah.
But it's not about taking patients away from the physician. It's about sharing. It's about getting your own group of patients. And patients, like Laura said, give us a try. You'll understand once you meet us and get to know us and see what we are about.
Well, first of all, I don't think any one of you or anyone who's working for Lehigh Valley Hospital in the network would do anything that they're not sure of. Okay,
Absolutely
you're
not.
just not going to just take a person. You're going to make sure you're giving that person the perfect health care that they need. So when do you have to do for people who are not familiar with you, other than hopefully at the end of the show they'll really get an appreciativeness of what CRNPs are. You have to explain to your patients who you are, what you do. Yeah. And
every time I enter.
What are some of the questions they ask you then?
What are you?
Okay. Who are you? Yeah.
It's usually, what are you? What do you? It's the same questions that we've kind of gone over. What makes you different from a physician's assistant? Are you a physician's assistant? Can you order my medications? Can I come to you with this need versus this need? And yes, you can. We handle acute, we handle chronic.
Yeah.
So it really is about educating, but we need to be given the chance to do so.
Yeah. Have you ever at any point in time with any of your patients had to admit them to the hospital?
Yes.
Yeah. So you can do that as well.
We do. We can send directly up to the emergency room. We could do direct admissions, at which point we call our hospitalist program, or if we have physicians that the patient's previously seen that their doctors do their own admitting, we consult with them, speak to them, discuss the case with them, and then at which point they take the care over at the hospital.
Okay. Now, looking at the both of you, to me, you're very young, okay, because I'm 40. And to me, Lisa's laughing over there. So when you, sometimes, again, in this area, it's more of an elderly area, people figure, well, what does she know, okay, and you have to overcome not only who you are, what you do, but the fact that you are young. So here again, you got the experience, correct, Laura?
19 years.
19 years. So you know a little bit about that,
Just
right?
a little.
Okay. So healthcare has really been expanding and changing, okay? I'm sure when you started 18 years ago, it's a whole different ballgame today, correct?
Oh, certainly.
Yeah. And as you progress, I know doctors have to keep up to date with what's going on in the latest in medicine. When I had Dr. Huxner here from the oncology department, there's a lot of new drugs out there for people who are chemo or taking chemo or cancer recovery. So there's a lot of new advances. What is some of the things that you have learned or come down the pike as far as new innovative ways you're treating people, or is it the same old way?
It's definitely not the same old way. Like Laura, I have 15 years into nursing now, and when I graduated until now, it's constantly changing, whether it's hypertension meds, cholesterol medications, the categories of medications. The way we go update on things is conferences or literatures, different representatives that you talk to from different companies. It's constantly changing. So whether it's just reading a journal to keep up with things, it's constantly changing pretty much on a month-by-month basis with different things. It really is.
You do a lot of continuing education?
Yeah, so we have requirements. So when we recertify, we have certain requirements for education credits. So we can't just sit back and kind of get stagnant. We need to keep on top of current practice and show the state board and our certifying board that we're doing so. So we do that, like as Jen said, through journals, conferences. Sometimes some of us present at conferences. There's a whole bunch of things that we do to stay on top of things.
And I think that's so critical because a lot of things change. I mean, people have every person is different, okay? So some person may have a different cholesterol level versus a blood pressure, etc. It doesn't mean that because you have this, the other person should be the same as that. So you say, well, I heard that, your blood pressure should be, and then all of a sudden, oh my God, that's it, the party's over. And that's where education comes in, okay? So you do a complete physical, for example, a new patient comes in, you don't know them from low to hay, okay? What's the process here?
It's, again, patient dependent. You go through their family history, their social history, their hospitalizations, their past medical history. It's each to their own, like you said, Sam. So you do a head-to-toe assessment, and you put it all together and come up with a plan independent to each patient. It could involve blood work. It could involve referrals, depending on their age, for potential colonoscopy to our GI group. If they're not up to date, if they're female, with a pap and mammogram, just dependent upon each case.
In this area, as healthcare is improving and we have all the facilities available to us, and as I say, I'm the biggest baby that you could in the works. I mean, like I go into the doctor, my blood pressure's up like to the roof because I'm going to die. You know what I mean? And I think there's other people like me because you're always apprehensive. So the idea of having that bedside manner and making me calm down, okay, and then proceeding to, once a year you should definitely get to see a physician, or they can come and see you once a year, right?
They can.
Absolutely.
And you'll do the entire routine. Folks, I'm talking to Jennifer Yourey, who is, and also Laura Herbener, who are certified registered nurse practitioners. Folks, they really do a lot, and we'll learn a lot more about what they do when we come back after the break. Welcome back to the Sam Lesante Show, folks. Remember, you can see us 24/7 on ssptv.com. My email is sam@ssptv.com. And for those of you on Service Electric Cablevision in the Greater Hazelton area, we're HD now on channel 513. So we're on both channels, 13 and 513. In Mountaintop, Wilkes-Barre, and Kingston area, folks, we're on Service Electric Communications Saturday and Sunday evenings from 7 to 11 p.m., where you can watch us up there in Mountaintop, Wilkes-Barre, and channel 92. My guests today, we're talking about CRNP. That's Certified Registered Nurse Practitioners, Jennifer Yourey and Laura Herbener, who are CRNPs, and they're giving me a great education about Certified Registered Nurse Practitioners. Once again, you have to go through a lot of studying to become a certified registered nurse practitioner, and you are part of the Lehigh Valley Physicians Group, right?
Yes.
So now you were talking about, again, just to repeat, maybe some people are going to the channels and they see two pretty girls, not me, but they see you and they say, well, what's going on? The difference, because the need of healthcare today is expanding, okay, here comes CRNPs, okay, can we trust you?
I would like to say we've been around probably since before 1965, but the first formal program was created by two physicians back in 1965. So we aren't very new. So yes, you can trust us.
Yeah. Well, here again, because again, to get my mindset, okay, Jennifer, is the fact that I want to make sure, first of all, I'm sick and I'm coming to a doctor or a doctor's office or going to your office. Now, you could practice by yourself, right? You could have your own practice.
Absolutely. We could practice independently, a freestanding office on our own. We don't need to have a physician on site. A lot of times we don't even have to have a physician co-sign or sign our charts with us.
Now that says a lot.
And also, you don't have to be sick to see us. We also encourage you to come for a well visit, a physical once a year, because a lot of times things are detected on well visits and physicals and picked up upon.
Absolutely.
So if you want to give us a try, come for a well visit.
Yeah. The different doctors and people like you who come on the show, I know of two people specifically that we basically saved their lives by having these shows. One was a person who were talking about colonoscopies, okay, and that you had said they heard on the show, and I waited 3 years like an idiot. I mean, it's a piece of cake, so now every 5 years I go, and if you hit 50. But anyway, she went and they found the polyp, and thank God because it was just about in that situation where I forget the first stage or whatever it is, and there's another person with had some kind of blood pressure problem. But you know, just to get out to have that. If you're feeling good, go for your.
Right.
You recommend that, Laura?
Oh, absolutely. Especially because at the wellness visit, we can talk about wellness things like your health maintenance and your screenings. If you come to us for a sick visit, if you come to me for a sick visit and I see that your health maintenance is out of date, I'm going to ask you about it while you're there because I don't know when I'll see you again. And then maybe I'll give you some education, but you're sick. So how much are you really retaining? So that's why we recommend you come in when you're well, because it's an opportunity for education that can work both ways.
Okay, and now to do that, folks, it's a very simple number. It's 570-5014, the number 4, LVH, okay? And just ask for, you know, you're looking for a physician's, a certified registered nurse practitioner. We call them CRNPs in the medical profession. I mean, you don't have an honorary doctor's degree from Geisinger. Seriously, I really do. I do. And I have it on my wall, so they come in and say, "Oh, you're Dr. Lesante." Yes, I am. I have a jacket too, says Dr. Lesante. I don't know what that has to do with CRNPs, but I thought I'd throw that in. But I can't practice. That's the problem, you know. Now, once again, the importance of CRNPs are, I mean, it's expanding in healthcare. And I can feel totally comfortable by coming to you. And if the doctor is tied up and they have Laura or Jennifer, I have no problems with that, correct, Laura?
Right.
Okay. And now you can prescribe medicine. You do not have to get the doctor to approve it, okay? If you do need any kind of consultation, Lehigh Valley Physician Group is all over the place. Have you ever been able to, I mean, have you consulted? Oh, yeah.
Absolutely.
Yeah. To feel comfortable with that?
Oh, yeah.
Yeah. And once again, if it's something that's really severe, okay, then you could recommend them going to either the hospital or, when do you bring a doctor in?
It's case dependent. I personally, from my personal standpoint, if I'm not sure of something, if I have a question about something, or you know, anytime you're just basically not comfortable or you think it's beyond your scope, you get your doctor involved.
Such as referrals. So a family physician, if you come into me, if you come into him or her with a bone problem, and they've done their thing and it's outside, they'll refer to an orthopedist. It's the same for us. We'll look at it, we'll do what we can. If we can't do more, we'll refer you to the specialist.
And you have certainly many patients, okay? And those patients, you say now that they come in saying, particularly if you're in Mountaintop in your house, is there a doctor in your office in hometown?
There is on a part-time basis sometimes.
So you're there all the time?
I'm there full-time.
And I can, if I'm in Tamaulipa listening to the show or whatever, I could just call that 501-4LBH and ask for, you know, if they have a certified registered nurse practitioner in the area, and they'll refer them then to your office.
There's also a direct office number too.
Okay, all right. Same thing.
Ask for Jen.
Ask for Jennifer. Well, you're Mountaintop, right?
Yes.
Okay.
Yes.
So as you know, you do continuing education. How often do you do that? Every year, or how?
It's ongoing. Yep, every year.
Yeah. Do you have conferences? Okay. And this is, here again, you're a state-of-the-art, or learning what's happening in the medical profession. Okay. All right. So just to reiterate, what is a certified registered nurse practitioner again? What do they do?
Certified registered nurse practitioners care for patients with acute illness or chronic illness. We can prescribe, we can refer, we do health maintenance, and our big focus on education. Okay.
And Jennifer, we could feel definitely comfortable going to a certified registered nurse practitioner.
Absolutely. We have 15 years, 18 years of clinical background training and experience, if you will. Mine was personally in ER. I believe yours was in ICU, or?
I had some mostly acute care.
You know, so we bring that in our advanced practice setting now of treating, managing illness from all aspects, whether it's a well visit down to a chronic condition.
Well, it's gratifying to know this because, again, some people, again, want to go and see only the doctor. In most cases, maybe you don't really need to see, but you feel very comfortable by going and seeing a CRNP, correct? Well, thanks for coming on the show and giving me an education. I always learn something on these shows. So you've been on before, so you've been, Jennifer, right? Folks, it's Jennifer Yourey and Laura Herbener. They are certified registered nurse practitioners. Feel comfortable, folks. You don't have to worry when you go and see them, as you heard. 501-4LVH. They are part of the Lehigh Valley Physicians Group. And if you need them, you should definitely go and see them at least once a year just for a wellness check. We'll see you next time.